Welcome to Birds.Bees.Bodies, a Planned Parenthood of Southeast and North Florida podcast where we break barriers, tear down stigmas, and promote open discussions on sexual and reproductive health. Get the buzz on topics from puberty to menopause, contraception to conception. No topic is off limits. So sit back, relax, and let's dive into a judgment-free zone to promote sexual wellness. Welcome, everyone, to the Struggles in the Bedroom episode of Birds, Bees, Bodies. This is a new podcast by Planned Parenthood of Southeast and North Florida, where we have candid conversations about sexual and reproductive health and provide medically accurate information and practical advice in a supportive and inclusive space. And of course, this episode, we're talking about all things struggles in the bedroom. We take a look at what are some of the types of sexual dysfunction and common causes. And if you have symptoms, is there a way to treat it? We are also going to bust some myths on erectile dysfunction, premature ejaculation, arousal disorders, and more. So we're really excited about this. I'm Michelle Quesada, VP of Communications, your host, along with my co-host, Clara Truyenque, Communications Manager for of Southeast and North Florida. And we are welcomed today by some incredible guests who are part of our affiliate, our organization, Planned Parenthood. They work in the medical and education department, and I will let them introduce themselves to you.
Hi, I'm Samantha. I go by Sam, and my pronouns are she, her. I've been part of Planned Parenthood for about 8 years, and I am the new program director for sexual dysfunction. I started my career, like I said, about 8 years ago, was really interested in preventative care for folks, wanting to know more about their body, prevention, and treatment. So that was my main goal as a nurse practitioner. And I'm really excited to be here today and talk more about sexual dysfunction and how we could help folks as much as possible so that they could understand their body a little bit more so that they could be happy in the bedroom.
Hello, everyone. I'm Bree. I am an ASEX certified sexuality educator. I am also a program manager in Planned Parenthood's education department. I have over 9 years of experience in the field. I received my master's in public health with a focus on health promotion and sexual health education. And throughout my career, I've worked in various realms of sex education, including program management, curriculum and instruction design, workshop facilitation, and research. I'm also a sexual wellness coach where I work with clients to help them prioritize pleasure, not only inside of the bedroom, but also outside of the bedroom for overall health and well being. So I am excited to share my insights from an educator perspective.
Wonderful. And we say struggles in the bedroom, guys, but this can literally be struggles anywhere you decide to have sexual activity, right? Like and exclusive to sexual activity. So I just want to put that out there. Clara, do you want to kick us off? I know we've heard of different things of what is sexual dysfunction. Do you want to kick us off with that topic?
Well, I'm actually here to learn a lot from Samantha and Bree. Let's say that I am not a professional in the topic, so I'm pretty sure I'm not because I have had those problems, thank God, at least not for now, but I would love to hear more and more about these kind of things that, for example, topics that we are are kind of taboo and we don't always talk to people about. For example, performance anxiety, right? I have read a little bit about it. I want to know everything about these sexual dysfunction issues that not everyone talks about, but many people experience. And as you said, Michelle, not always in bed, like anywhere you would like to have sex.
Right. So sexual dysfunction is, sometimes they call it sexual disorders. And it's basically defined for those who are having probably difficulty having sex or even enjoying sex, right? And that it causes a lot of distress or significant amount of distress in their life. So in a nutshell, that's what it is. So it's having like issues like whether it's unable to reach orgasm, unable to have any sensation, right, to the genitalia area, and perhaps even lubrication, pain during sexual intercourse. So there's a variety of different, I guess, quote unquote, disorders that can occur that could cause you to have this difficulty or problems enjoying sex.
And I'm glad you bring that up, because there could be scenarios in your life where maybe you don't orgasm every single time you have sexual activity, but that doesn't bother you because you know that eventually you do. So this is something that happens to you and it bothers you, that this creates some anxiety, stress in your life, that you feel like there's something with how you want to have your sexual life.
Exactly. Yeah.
And what kind of different types are there? Because when we hear sexual dysfunction, we automatically think, oh, ED, erectile dysfunction, or premature ejaculation. There's so many different types out there.
There are a lot of different types, and there is the erectile dysfunction, which is it's very common with those people who have a penis who aren't able to get erected, right? Or aka known as getting hard before having sexual intercourse. So it's an issue, a problem. It could be very embarrassing for the person. The partner may feel that what's going on with my partner who doesn't want to get, hard or erected for me. So it could bring a lot of issues as well in the bedroom, or like, again, anywhere where you like to have sex, right? Or be sexually active. So it's someone who cannot be able to perform because they can't get erected or hard. And there's also premature ejaculation, which is when the person with a penis ejaculates before their partner may even reach orgasm, right? Or they also say, like, when you come too quickly, or you've probably heard the term before of like 1 minute man, or 1 minute person, right? So it is when the person is able to climaxes beforehand, right? That there was not enough time for the other person to even experience any type of pleasure. I don't know if Bree wants to add on with those two that I had mentioned or not.
No, except for the fact that I think it's great that we're talking about the different types, because a lot of people are not aware that sexual dysfunction is an umbrella term for so many different types of areas where anyone can experience the inability to just enjoy pleasurable sex
Yep.
for so many of these reasons.
Yeah. And those two that I had mentioned, the erectile dysfunction and premature ejaculation, that is seen with people who do have penises, because there's different options and treatments for it that we could definitely dive into much later. But then we also have hypoactive sexual desire disorder, which the person has little or no interest in sex at all, and affects the person, like I said, significantly, and it causes a lot of stress in their day-to-day life. That's been happening for more than 6 months, and that it's not caused by medications or mental health disorders or specific surgeries that were performed, trauma. So things that are not caused by that will then be someone who could be diagnosed for the hypoactive sexual desire disorder, which is actually more common than a lot of people think. And they tend to basically say, well, I'm stressed, or I don't have time, or, I've never really was someone who was interested in having sex. That's just not me. But, we're all human. We all have some form of desire, right, to want to have sex. So that's another form of sexual dysfunction. And then there's also arousal disorder, which is someone who has the inability to possibly get lubricated or wet, or someone who is incapable of having engorgement of the genitalia, right? So having that blood flow to the clitoris. And there's also as well the orgasm disorder, someone whose orgasm has possibly gone a little bit weaker, or feels as if they're going to orgasm but they can't orgasm. So there's a variety of different types of sexual dysfunction out there that I feel a lot of people don't know about.
And I'm hearing you saying all these kind of problems, and people that are going to or are listening to this will also wonder, well, okay, all these are problems that might affect you or not. I don't know if you can tell you have experienced it in the past or currently, but are all these symptoms treatable? Like, can we revert a arousal disorder, orgasm disorder?
Yes, most definitely. And it all just depends on what the symptoms it is that you're having, right? So, for example, someone with hypoactive sexual desire disorder, we have to first see if there's any underlining that's causing them to have this, right? So it's important to review your medication list, being honest with your practitioner or your provider, physician, whoever's providing the care for you, and letting them know the meds that you're on. Because a lot of medications out there can cause, that low sexual desire. So what medications is this patient on that can be causing it, right? So there are, like, for example, a lot of people who are on antidepressants, it can cause low sex drive. But then there's a form of treating that, which whether it's adding another form of medication to help with it, that can then alleviate that sensation of having that little interest of sex. Or, for example, someone who has anxiety or depression, right? We want to make sure that they're being treated properly for their anxiety or depression, so then have that feeling and sensation back of wanting to have sex. So we have to make sure that there's these modifiable factors that we can fix. And let's say if the person has none of that, right? They're like, I'm not on any medications. I haven't had any recent surgery. I have never experienced sexual trauma, or I don't have issues with my body image, etc. Then there are treatments for it. And there's a lot of people out there who may not know, but there's a little pink pill for women with persons with vaginas, right? So we could actually treat them with that, or as much as treating with stimulation, clitoral stimulation.
Yeah, so that's actually a really good point, because when I am working with clients in a one-on-one educational setting, that is the first thing that I do through an assessment to figure out, okay, before we even start with a medical intervention, let's go through a checklist of items. And so some of the common things that I've seen are simply sexual self-esteem issues. And so that includes not really feeling confident in your body for whatever reason, whether it's you've just given birth, you just been diagnosed with a chronic illness, or anything that would affect or impact a person's sexual self-esteem. And so some of the ways to overcome that include practicing affirmations in the mirror, getting naked, getting comfortable with your body, pleasure mapping, which is figuring out what you like, what you don't like, and just learning your body all over so that you can communicate that with your partner. Another cause that is not often looked at is just not being stimulated sufficiently. So I always like to say foreplay is all day. And so for a lot of people, if you're
I
not
was gonna say
stimulated,
that. I was going to ask that, Brie, because how about, I'm just thinking, okay, this is not going to be the specific case for everyone, but how about if your partner does not know the field, and
Teach them.
and the problem of your sexual dysfunction is not actually your sexual dysfunction, is that the skills that your partner has are not enough, let's say. So can we teach the partner?
exactly. And so that's a good point. So that comes with you learning your own body through that pleasure mapping process, understanding what turns you on, what does not turn you on, what you like, what you don't like, exploring with various toys, stimulus, or sensations. There are so many different types of clitoral stimulation, and
Mhm.
toys that allow for double penetration, and toys that work for both partners where you both can enjoy the experience together. And so there are different ways that you can experiment. However, it first starts with you learning yourself, because once you become the expert of your own body, then you're able to communicate that with your partner so that they can help please you as well. And I think that we don't talk enough about how sex is very mental. Sex is very mental for a lot
Yeah.
of people. So if there is discourse or a lack of connection with a person that you're engaging in sexual activity with, if you can't get out of your mind, you're not going to be able to get into your body to enjoy the experience. And so that communication is key for a lot of people to really enjoy that pleasurable sex. And so that's why we talk about sex doesn't start in the bedroom, but it starts outside of the bedroom with the communication, the foreplay, stimulating someone mentally, making sure that you're connected so that you can really get out of your head and into your body to enjoy that experience, and be open to communicating with your partner. Hey, I didn't like when you did XYZ to me when we were engaging in our sexual encounter last
Mhm.
week. So let's try this time. Or this is what I like. Can you put your head here? Can you move your hands here? And you have to just be open to that communication, but also the receiver has to be open to that feedback as well. And so I think those things are also crucial for having a pleasurable
then how do you
Mhm.
expect your partner to know what you like and help you reach an orgasm?
Yep.
So it's more like learning your own body, learning what you like, what's going to help you get to climax and enjoy sex. And then, if that there's a disconnect between what your partner's doing and what you like, then having those conversations and being transparent about it. Such a good point.
Yeah, and we have, and when I see patients in the clinic, I've had I've had a lot of patients come in saying, "Hey, it's the first time I'm going to be having sex. I want to know a little bit more about my body." And let's say if they're there for, their well person exam, right? I even tell them, if you feel comfortable enough, we could go over it with your anatomy, right? Because a lot of people don't even know where the clitoris is. They don't know where that
Right.
stimulation is, right? And it may sound funny, but here, like when I'm with my patient, we actually have mirrors in the actual in like the setting for in the room for the patient. And I've had patients come in for the appointments to know more about their body because they're about to be sexually active. And I tell them, if you're comfortable enough, grab the mirror and we could go through the anatomy. And obviously, if they feel comfortable, safe, and sometimes they even ask for a chaperone or even their partner to be there to have a better understanding. And they'll ask me, well, what would I do? Right. And after I examine them, show them like, body parts anatomy, and even show diagrams like that we have in the room, I tell them about either stimulation with a vibrator, right? And letting them know to a certain point that they'll feel that sensation, right? Of point of orgasm. And when it feels too much, it's probably you're about to climax, right? And teaching them that, because a lot of patients don't know. They'll sit there and they're like, well, I've had sex and I've never experienced that before. And I'm like, know your body. So it's such a great point that Bree mentioned, that thing, like, know your own body, explore what you like, and then share it with your partner.
And
Absolutely.
Samantha, I just wanted to comment on your point and say thank you and kudos to you for creating a safe space for patients to be able to have these conversations with a healthcare clinician. When I'm working with clients, one of the things that I also talk about is being vocal when you are working with your healthcare provider to
Mhm.
talk about your sexual concerns that you may have, because some things, are beyond my realm or my scope of practice. And so it does require the clinical or the medical intervention. And so being able to have those conversations, being open to asking questions. So I have clients write down a list of questions about their medical history, the medications that they're taking, and just being really transparent and vulnerable and just real with themselves. Like, I'm having this challenge, this, I need to go see a healthcare provider. So thank you for creating that safe space and educating clients, because you don't see that too often in the clinical setting.
Yeah, because
Absolutely.
it's such a fast pace, right? But it's like, listen,
Right.
I had a patient the other day as well that, since we're doing mental health now via telehealth, and they're on a SSRI, which is a medication to help with anxiety and depression. And they're like, well, it hasn't really been working. I'm so anxious, depressed, but I really can't even have sex. And my first thought was, okay, sure, I could up your dose so that you don't feel so anxious and depressed. But she was really struggling, not being able to have orgasm. So I said, hey, we can add another medication that won't affect your anxiety, like that won't affect your sexual dysfunction, but can actually boost up your anxiety and depression. Because to me, it was crucial to know that she was able to have an orgasm and not be affected that way, because that could depress you even more, cause you more anxiety, you know?
Can
Absolutely.
I also speak to that as well? I
Yeah.
think it's important for people to be able to identify their orgasm. A lot of people say they've never experienced an orgasm because they don't see the squirting happening. That is not the
Mm.
only form of a physical symptom of orgasm. If your heart rate is racing, you start to feel your body contracting. You start to feel, all of those things that give you a rush. You're experiencing an orgasm. You can cream and experience an orgasm. So it doesn't always have to be this big gesture of squirting to say, oh, I've had an
Mhm.
orgasm, or, the whole climax. So when we think about the sexual response cycle, that can look different for different people. So that's also something that I do teach people, particularly vulva owners, like how you identify what an orgasm looks like for you. This is what it could look like, but that can look different for different people. And so I think that's important as well, to understand that it's not always a big grand gesture of what that looks like for you.
Right. And not every orgasm is the same, right? Some of them are more intense, some of them are a little bit quicker.
Mhm.
We don't
Correct.
like ones, but they come and go, right? I do want to get to one point that we brought up earlier that I think is really important to bring up, because I hear this a lot from people who may say, oh, well, my partner's experiencing premature ejaculation, or my partner's experiencing, erectile dysfunction. And I want to talk about the erectile dysfunction part of it too, because I do hear that from people that they start to blame themselves and think, oh, well, my partner must not be so into, they can't get hard, or, something that I'm not doing enough to be able to stimulate them. It's my fault that I can't get them hard, or I can't stimulate them. So I want to talk about that too. Like, what are some of the causes of those types of disorders? And can it be something else that is happening with, blood flow in the body, or something that is completely independent from the actual physical activity that's taking place in that moment?
Yeah, absolutely. Like mentioned before, anxiety, depression, what Clara had said as well, the performance anxiety can also be the cause of it. Body image is one, and that's something I know that Bree had mentioned prior to. And even relationship factors is something going on in your relationship, right? That can be affecting that as well. So it's not, it could be many other source factors, like I have mentioned.
I like to add also to that your diet is so important. Healthy
Oh, yeah.
nutrition,
Yeah,
making sure that
drinking
you're
too
eating.
much, smoking, all those things can affect
Yes.
the sex life.
So I don't know if you all knew this, but cigarette smoke actually reduces blood flow in the
Mhm.
body, which in turn decreases blood flowing to the genital areas, which in turn reduces sexual arousal. So people have to understand that what you consume into your body can absolutely impact your sexual performance as well. So regular exercise is important, of course, under a doctor's orders if you have any type of underlying medical conditions, but staying hydrated, drinking enough water, all of those things factor into your health, which can impact your sexual health.
Yeah, and same with specific drug use, right? Cocaine can actually cause issues as well. Alcohol can definitely go ahead and affect as well for erectile dysfunction, and stress. The number one, the number one I say killer. Even stress can affect as well. So, and any past traumas that the person may have had as well.
So let's get into busting some myths, and Clara has
Oh
some
yeah.
myths that we've heard that we want to go ahead and address.
Well, one just came to my mind that I wanted to ask, and is I have heard in the past that do you guys know the heated seats in the car?
The what?
Do Yeah, the heated seats in your
Oh,
car.
heated seats. Okay. Yeah.
Yes.
Uh-huh.
So, how about the heated seats in your car? Can they cause sexual dysfunction if you drive all the time with the heated seats? I'm
So
totally
you're saying
serious. I
like,
have heard that in the past.
Well,
like
for
sensitivity.
me, oh, go ahead.
No, I was just going to say sensitivity to heat or warmth. Like, is that, could that, because I know that really hot baths can impact like sperm count and
Yeah.
things like that. So I wonder, that's a good question, Clara. Like, can sensitivity to temperature impact your sex drive?
Yeah, because imagine your area is gonna be over there like very warm. If you have to drive from Miami to West Palm Beach, it's an hour and 30 minutes.
I don't know
Having
who's
your
using heated seats in Florida though. If
Yeah, I
you
was about to say that.
Well, I guess I'm the only one, but my partner turned it on by accident yesterday, and I was feeling too warm down there. And I remembered, I thought, what's going on? I mean, we're like 60 degrees, but still, it's too warm down there. So imagine, especially for men, is what I have read that can affect them directly to their like performance or I mean, sexual dysfunction in general. What do you think?
Well, in a medical perspective, just too much exposure to heat, I would think that the warmth, like how Michelle had said, it could affect sperm, but this is continuous, amount of exposure to heat. And for people with a vagina, if you're constantly hot down there, you're more at risk for infections like yeast infections, bacterial vaginosis, which then can cause pain during sexual. But I'm guessing it would have to be a long time of exposure with the heated seats to cause some type of injury.
Yeah, okay, like Miami, Orlando every day. Okay, okay.
A lot of people who use jacuzzis, right? Or who are
Uh-huh.
warm, they tell you that to only be in the water for a certain amount of time because it can affect. But again, I think it would have to be a long time exposure. I don't know.
Okay, I have one I want to bring up. So only inexperienced people with penises can suffer from premature ejaculation. Inexperienced meaning that they don't have a lot of experience with sex. Is that
I'll
a
let
myth?
you answer
True
that
or
one.
false? True or false?
Yeah, I think it was addressed earlier that that is absolutely false because as we've already discussed, there are so many different factors that contribute to sexual dysfunction, including premature ejaculation.
Many people think, oh, imagine like I'm 25, I'm 18, I'm 30, I'm too young to have ED, erectile dysfunction. What do you guys think? Is this true?
There's no age. It
Oh,
has
absolutely.
no age. It can happen to anybody.
So
Um,
anyone.
if it's something that, let's say, someone who didn't have erectile dysfunction and out of nowhere it just started again, definitely checking for medical help to see what is that underlying cause. That it was something that you were able to perform sexually, I don't know, last week or a month ago, right? Or well, it's actually more by definition more than like 6 months, but the past 6 months you've been able to perform just fine, and then out of nowhere. So what is the issue? What is the problem? So it's very important to dig in and find out, is it a new medication? Was it recent surgery that you just had? Have you recently been under a lot of stress? Hormonal changes too. And in people with penises after the age of 35, your testosterone starts to drop about 1% per year. So testosterone levels that are significantly dropped can definitely affect and cause erectile dysfunction.
Great. And last one I'll address is Viagra is the only treatment option for ED. That myth.
Nope. Just like we said before, there's other great ways before going to the medicine, right? Knowing about your body, knowing self-image, therapy, yoga, mindfulness. It's all mental. For at least the genital arousal disorder, there's actually an FDA approved device called EROS, which is a pump stimulation to allow blood flow to the clitoris. So that's one of the options. I know Bree, since she's the expert with all this education, I'll also let her cut in.
Yeah, so from a non-clinical standpoint, there are different ways to address sexual dysfunction that don't necessarily require the clinical intervention. So one of those is educating yourself about your sexual dysfunction. You have to know, well, that includes seeing a healthcare provider, but also just being honest with yourself and understanding that it's okay that you're experiencing this. It may just only be a short term moment that you're experiencing this, but you have to be okay, and we have to get rid of the stigma and taboo associated with sexual dysfunction and create more safe spaces like Sam you're already doing in terms of having conversations about sexual dysfunction. So learning about your specific sexual dysfunction, having those conversations with your healthcare provider to ask the right questions, to figure out what treatment plan is best for you. Additionally, the self exploration. So, again, that masturbation, paying attention to your own body, figuring out what pleasure looks like for you, and also redefining what sex may look like for you. So, penetration may have worked at one point for you, but now you have to kind of readjust and redefine what sex looks like for you, and not just in terms of sex itself, but just being able to experience pleasure. So don't focus on the end goal of the orgasm, but focus on enjoying the journey and the pleasure in itself. And I think that can help improve. And then lastly, I'll add communication. So again, having those regular check-ins with your partner, addressing any issues or challenges that you're having, and just being transparent about those things, so that you can truly connect with your partner and you both can work together to find solutions that will prioritize both people's pleasure during the sexual experience.
Thank you so much, Bree. And yeah, and I was leaning more towards medical treatment options because I know that there are some issues that you may have to consider, either like you said, Sam, the little pink pill or the little blue pill, or even maybe a hormone replacement if you're having really low hormone levels.
Yeah, so with medical aspect, when it comes to, let's say you've tried all of the above that Bree had mentioned, and maybe it's not so much mental, maybe it's more like a medical condition they may be having that they can't reach point of orgasm for, because they just had pelvic surgery, right? That it's affecting like certain nerves and damage, or if there's recent radiation, chemo that could affect as well. As long as there's no contraindications with certain medications, there are the hormonal medications that you could take, whether it's estradiol, testosterone, because remember, persons who go through menopause, right? Those hormones are gone out of your system. So hormone replacement definitely is one. And as mentioned before, the little pink pill and the little blue pill as well that can help with those things. And then those devices for stimulation. It all just really depends on the type of disorder that the person's currently having to be able to find that perfect treatment for them, because everyone's body's different, and we have to make sure that we find the perfect one for them.
And in addition to that, I'll just add having an entire team. So it's okay to work with your healthcare provider, working with a coach, working with a therapist, an occupational therapist, a physical therapist, a sex therapist. So it's okay to have a team of people to help you get to where you want to be during your sexual pleasure journey.
So I thank you all so much for chatting with us. I hope all the listeners enjoyed as well. If you want to follow more of our Planned Parenthood of Southeast and North Florida content, please go to our website, ppsenfl.org. We also have our blog on there, Birds.Bees.Bodies, and continue to listen in for more exciting episodes on sexual and reproductive health. Thank you all so much. Have a wonderful day.